Hi, my name is Eric Coster, and today's discussion will be about post-traumatic stress disorder. It's mostly about combat-related post-traumatic stress disorder. A soldier returns from his second tour, or combat tour in Iraq. He has an underlying issue that has not yet been diagnosed. He and his wife have a mild argument over their animals, when all of a sudden the husband takes drastic measures and ends up choking his wife to almost unconsciousness. In 2006, I was diagnosed with PTSD, post-traumatic stress disorder. Since then, I have been educated and continuously treated for post-traumatic stress disorder. This combat post-traumatic stress disorder, also known as PTSD, which will be said PTSD from here on out, is an undeniable dilemma affecting our Operation Iraqi Freedom and Operation Enduring Freedom veterans, but it can be greatly diminished if family members understand the general symptoms, the types of treatments for PTSD, and ways to cope with PTSD victims. Today I would like to give you some information about the following: general symptoms associated with post-traumatic stress disorder, types of treatments for combat post-traumatic stress disorder victims, and ways to cope with PTSD victims. And so there are some general symptoms associated with PTSD, and I will give you a little brief summary of that now. But first I'd like to tell you, according to the article, what can we do about these staggering PTSD affected statistics written by Joe Lynn Corlison, states that the Department of Veteran Affairs estimates that 95%, I say again 95%, of all veterans returning from Afghanistan or Iraq have some sort of PTSD. It says Ilona Meger's article, Combat, Winning the War Within, says that PTSD symptoms generally fall into three main categories, which are intrusive, avoidant, and hypoarousal. It says, but knowing what the symptoms are, now we can go into the types of treatments for combat PTSD. So Lisa C. DeLuca is a licensed psychotherapist and social worker, and in her article, Treating PTSD, Types of Therapies for Combat Vets, states that the Department of Defense and Veterans Administration have jointly published guidelines for treating PTSD, which is recommended PTSD therapies known to be effective. It says the four main therapies are cognitive therapy, exposure therapy, eye movement desensitization reprocessing, known as EMDR, and stress inoculation therapy. Now we need to discuss some of the ways to cope with PTSD victims. That's many of the problems we have with our returning vets. We don't know how to handle them. It says in the article, 4 Ways to Cope with Family Members Who Have PTSD at livestrong.com, says family members need to understand about the condition of PTSD. So accommodate the patient's specific needs. Be patient and supportive. That's one of the main ones you need to do, is be patient and supportive. It says and participate in family therapy. That way, if you don't know, you will learn as you go. It says as we come to a conclusion, I would like to ask you to do me a favor. You need to constantly stay up to date on the techniques for treating combat PTSD by reading and researching as much as possible about PTSD and attending seminars held by leading professionals, or you can get on the computer and find articles, or you can get books from bookstores, or you can even ask the therapist themselves for more information, and most of the time they'll have it prepared and to give to you on the spot. It says, today we have learned the general symptoms associated with combat-related PTSD. It says types of treatments for combat PTSD victims and ways for family members to cope with PTSD victims. It says, I would like to also add, as we close, to prevent your family member from avoiding medical treatment. It says, I challenge you to thoroughly educate yourself. Know about the symptoms. It says, the symptoms and the treatment for PTSD. It says, and encourage your family member to at least seek one-on-one counseling. I also challenge you to learn the implication and consequences that go along with PTSD for untreated symptoms. And if you follow all these measures and guidelines that I gave you, and hopefully that you will, then your veteran will be able to get better and have a normal life. Thank you.